Our physical therapist will work with the patient right at the hospital room. We usually give a package between 8 to 10 therapies within the surgical package that we offer.
That's Dr. Max, a certified orthopedic surgeon who ensures your speedy recovery post-surgery with the help of one of the best physical therapists in Mexico. Excited to meet her and understand a therapist's role? Let's go.
My name is Dr. Max Crane. I'm an orthopedic surgeon here in Puerto, Vallarta, Mexico. And we have been here for 25 years as an orthopedic surgeon. And during their hospital stay, our follow-up team will come to the hospital room to get them up and around. Our physical therapist will work with the patient right at the hospital room. And the same therapist will follow the patient once the patient is discharged back to their hotel. Our therapist will go to the hotel to provide therapy.
My name is Adriana Robin. I'm a physical therapist, and I have been working with Dr. Max for 19 years now. I'm part of the team in assisting the patient to get to its best. I was born in Venezuela, and that's where I studied. I graduated in 1998, and then I came to Mexico in the year 2000. I met Dr. Max in 2003. We started slow, but like getting to know each other, and then more and more with the time, we just build a better and closer relationship and work relationship as well. The surgeries that we usually see are hip replacement, knee replacement, and spine surgery. Those are the most common surgeries. What I do is I just arrive the day after the patient had the surgery. I, of course, introduce myself and ask for the main questions, how the patient feels, make sure that he's comfortable, that he's not having a lot of pain, and explain a little bit of the physical therapy process, and then I proceed to do 3 very gentle exercises just to get them moving and to get them feeling that it's okay to move the limb or the body after the surgery. And the next thing that's very important for the second day after the surgery is to help him stand up. So they usually have a walker, and also the spine patients have a brace for support. And so I help them getting in, and I also teach them what the best way is to get in and out of the bed. Depending how the patient feels, we can use some paramedics that day to just be safe. They walk a little bit, they feel their body, right? They feel that the surgery was successful, they feel the body feels different, the pain is different in general. And then some very general instructions, and as the days go by, because I visit them 10 times, then I start giving them more and more information.
So the therapy, we usually give a package between 8 to 10 therapies within the surgical package that we offer. We offer 8 to 10 therapy sessions so that the therapist can start at the hospital, but then continue caring for the patient at their hotel room, wherever they're staying at. And yes, we do have a list of hotels we recommend, because we want patients to be comfortable. We want to have easy access to their rooms. Some hotels have very strict policies to allow anyone from outside the hotel to come in. Other hotels are a little bit more open. So we do provide a list of hotels that are very friendly towards medical tourism patients, and that allows our follow staff to visit them at the hotel.
The first 10 to 15 days are pretty much to rest more than anything. And that sometimes is hard because in this beautiful place, looking at the beach, they just all want to go out and lie in the pool, but this is just time for healing for them. Physical therapy has a very important role in the recovery of the patient. One of the reasons is because most of the patients have been injured, or their muscles or their joints have been in bad shape for a long time. some years, 1 year, 2 years. We have had patients that have been in really bad shape for 10, 20 years. That means that the muscles are very weak, there is imbalance in the skeleton, lack of strength for sure. If they don't do the physical therapy, they are going to end up with bad habits like limping, and if they limp, that's going to affect something else in the body, right? Their posture, and so it has consequences if they don't follow the protocol. That's why it's very important. It doesn't only work in a physical level. Physical therapy also teaches the patient that they are okay doing certain things, and so they're exploring the limits, and they discover that, oh, okay, I can do this, right? And they have somebody with them. It's not that they are exploring on their own. They feel safe, they feel secure, and they discover how much they can do, and in a safe environment or with safe limits. And that's a lot. It means a lot for the patient, right? Because they come from a different country, they don't really know what's going to be like here, and they feel very supported with the team in general.
Yeah, most likely it's a good idea that they can continue, because many patients, since they weren't using their knee or they weren't using their hip, they develop what we call muscle atrophy. And muscle atrophy, the only way it will come back is adequate physical therapy, and that just takes time. So yes, we do recommend them to go back and care for their joints or their back with signing up with a clinic back home, and to continue doing their exercises so that within several weeks, maybe a couple months, they can go back doing the things they love to do.
So it depends on the patient, how disciplined they are. If a patient is very disciplined and they follow the protocol all the way till the end, which I give them, I explain to them stage by stage. The first stage is when they are here for the 15, 20 days. Then the next one begins when they are home. And then everything starts to get a little more intense, more repetitions, more weight, or more activity in general. And then they should be able to feel, in, let's put the example of a hip replacement, that their operated leg feels just as the other leg that was healthy. So that's the goal, because these surgeries are designed for the patient to walk without limping or without any restriction after the amount of time that they need to exercise and pay attention to their recovery, right?
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.